Hey guys, my name is Heather Lindsay.
And my name is Cornelius Lindsay.
And I'm so excited that you landed on Life with the Lindseys.
This is so exciting. This gives us an opportunity to share our life with yours.
Yes, we're going to be talking about everything from entrepreneurship to ministry to your purpose to why you are here, family, parenting, relationships, marriage, sex, you name it. We are talking about it.
So thank you so much for joining us today with Life with the Lindseys. Enjoy it.
Hey, everybody, and welcome to Life with the Lindseys.
This is Cornelius.
And this is Heather. And we have a super special guest here with us.
We do.
And do you want to, so essentially you guys know we are business owners. Like we've been business owners for, gosh, how long would you say?
Years.
Yeah. It's
been a long time.
Yeah, it's been a long time. So we have a guest from CrowdHealth. His name is Andy Schoonover. And what's crazy is when I left my company back to go into full-time ministry and business, I was, it was like 2011, 2010, around there.
Right.
I was the HR benefits manager, y'all. And I didn't have insurance. So I opted for Cobra. We paid an ungodly amount of money that year, right?
Right.
And what I love about CrowdHealth is they're freeing people from the bondage of the healthcare costs.
Yeah.
So
I think the one thing that I'm really excited about, Andy, is the story about how this got started. When I initially heard it, it definitely pulled at my heartstrings. So without further ado, Andy, the CEO of CrowdHealth, could you kind of give the people some background about you, and then if you could, I want you to jump into that story that inspired you to start CrowdHealth.
Yeah, no, thank you all for having me. I appreciate it. And, what you guys were just saying is something we hear over and over and over again with, healthcare costs increasing. And how do I pay for these healthcare bills, these huge healthcare bills that my families are being burdened with? I think you used it beautifully, the bondage of healthcare cost, right? I was running a healthcare technology company, an entrepreneur, and sold that company, rolled off. And as such, I wasn't able to get health insurance through my employer. And so I thought I went to healthcare.gov. It was the place I thought was the only option for me to get health insurance. And so I ended up paying about $1,200 a month for me, my wife, and my two girls. And it worked great until I actually had to use it. My little one, who was 1 at the time, was having recurring ear infections. So any parents out there, I'm sure can commiserate how that is. And so we went to the ear, nose, and throat doc, who said that she needed to get tubes in her ears. So we said, okay, let's get tubes in her ears. Headed off to the local hospital, 15-minute procedure, and we got the bill, and it was $8,000. And I said, wow, 15 minutes for $8,000. Pretty much any of your listeners would love that hourly rate, right?
Right.
And but I was like, okay, well, I have health insurance, and so the health insurance is gonna pay for this, and that's the whole point of getting health insurance. Well, I got a note about a month later that said, we find that this procedure was medically unnecessary, and so we're not gonna pay for it. And I said, hold on a second here. I have an ear, nose, and throat doctor in Austin, Texas, which is where I live, who looked into her ears. She had a perforated eardrum. He's like, this is so bad, I'm going to delay my vacation by a day to do this because I'm concerned about her long-term hearing. And then somebody in New York City, 1,000 miles away from me, decides that it was medically unnecessary. I'm like, this just feels like a scam. It feels like a scam.
Yeah.
And so I called him and I said, I quit. Like, I'm not going to continue to pay you $1,200 a month. And, you're not going to step up to help me and my family when we need the cost. And after doing some research, what I found is that 1 out of every 6 healthcare claims submitted to plans on healthcare.gov are rejected. 1 out of every 6. If you're in Tennessee, it's 1 out of every 3. And it's like, that just doesn't make any sense. And so, we quit the health insurance thing. Me and my family, and I said my 2 girls, we've been uninsured for the last 2 years. We've never felt so free in our healthcare, and feel very confident that if we had a big healthcare cost pop up, that we'd be able to do that. So we've kind of taken those tools, put them together, and the culmination of that has been CrowdHealth, and which is just a set of tools that allows you to operate outside of the existing health insurance space.
Wow.
And The reason why I wanted you to share that story, Andy, is because there are, as you mentioned, there are so many families who are having to endure that right now, where we're paying into a system that, as you in your words, that only works until you need it to work, and then when it doesn't work, you're like, what am I left to do? I know for my wife and I, we haven't after she left her 9 to 5, after I left my 9 to 5, we didn't have traditional health insurance, and so we found great comfort in crowd shares and things like companies like CrowdHealth. But one of the things I wanted to ask you also, Andy, is what is it that really separates CrowdHealth from the rest of the pack?
Yeah, so I think the really important thing here is that our system is set up so that the health insurance plans and the doctors who are actually providing care are set up to be against each other. And as such, the doctors raise their rates because it takes so much effort, so much time to deal with health insurance plans, right? So they spend about 30% of their time just dealing with health insurance, right? And all these doctors, I mean, they get into it because they love interacting with their patients. They love providing care. And so if I can make it really, really easy for the doctors to get paid, they're willing to take a price for that service that's about 30 or 40% lower than the price that they're willing to give to a health plan. So CrowdHealth, the way that we are set up, they get paid on the day of the service. There's no kind of pre-negotiations associated with that, no pre-authorizations. And so they don't have to wait the 60 or 90 days. They get the cash right at that time. And so it's hassle-free for the physicians. And that's really what they're looking for. Is there a way to work outside of the insurance ecosystem? And we provide them an opportunity to do that. And as such, they're giving us way better rates than you can get through the health insurance plan. So that really what differentiates us is we get those doctors paid quick, in cash, without the hassle. And that's kind of the core of what makes our pricing about 50% better than if you were to go to healthcare.gov. So the average family will save just about 50%, 40 to 50% versus healthcare.gov prices.
Which is absolutely amazing.
Yeah.
And I think that's one of the things that we would hear, oftentimes from doctors and from hospitals. And
you're out of network or, and that's a big thing. So there's no in network or out of network, right?
There's no network. Yeah, this is the beautiful thing about this is you can go to anybody you want, wherever you want, whenever you want. Your healthcare is really between you and your doctors without that health insurance plan getting in the middle. And it's worked really, really well. Nobody wants to go to a place that's out of network because your cost increased significantly. And a lot of times you don't know if it's in network or out of network, right? You may go to an in-network hospital, but there are out-of-network providers working within that hospital. And so you then are charged the out-of-network rate, which is above and beyond your deductible, to be in an in-network hospital. I mean, it's just craziness. I mean, one of the most hilarious things that I've heard is, health insurance is one of those services that just make us feel dumb. Right. Yeah. I mean, you can be at Harvard, Stanford, whatever, doctorate, and you have no idea how your health insurance works. And so really what we're trying to do is make something that is just super simple. Simplicity is one of our core values. Just make it really easy on the end user and the doc.
And I also wanted to ask you this, because I know one of the I'll say alluring things to me about CrowdHealth was the idea of the $500 payment. And that was being able to go to I'm going there for the service. I know how much it costs, but there's a $500 payment that I have to pay. And I think that really spoke to us because of the amounts of money that we've had to pay in the past, in situations. And could you kind of speak more to that payment process?
Yeah, our payment process is pretty simple. And it's that, the first $500 of any health event, so whether that's you having a baby, you breaking an arm, you tearing your ACL, whatever it is, that health event is $500 for you. So you would pay the first $500, and then we have this community of people behind you who will pay all of the rest. So your ACL tear, maybe a $12,000, surgery. It's going to include some rehab. It's going to include a number of doctor visits. All of those are lumped together in one health event that you'll pay the first $500, and the community behind you will pay the rest of that for you. So it's super simple. You walk into the hospital, guess what? It's $500. You don't have to worry about any of the other in-networks, out-of-networks. What prescriptions are they giving me? You don't have to worry about any of that stuff. It's $500, and so there's a peace of mind there that I think is really, really important for folks who are using CrowdHealth. And I would say is, I was fortunate. I've been fortunate. I can write an $8,000 check for my daughter's tubes in her ears. But man, 95% of the population, an $8,000 surprise expense, that is significant financial distress, right? And the whole point of having health insurance is if you have something big happen, then you won't go into financial distress. And we actually had 250,000 families last year, 250,000 families go bankrupt, even though they had health insurance due to medical expenses. I mean, that in itself tells you there's something wrong with this system. And that's why I'm so excited about CrowdHealth, because it's, hey, any big event, $500. And that's just easy to understand. And I think very, soothing to anybody who's like, oh my gosh, how much is this going to cost me? So that's kind of a key component of how we operate.
Yeah.
Wow.
Yeah. And speaking of health,
and saving money. We're talking about saving money on our insurance, y'all. And we're here to help you save money on your food as well. We love HelloFresh. That's actually one of our favorites. It's so nice because I can just show my husband a picture and say, pick which one you want.
She just says you want this one or this one, and I say that one.
Right. And the grocery stores are kind of, I don't know, there's not a lot of food there nowadays. I can't get all my ingredients. HelloFresh offers 50 different menu and market items to choose from every single week, from vegetarian, keto, you name it. Literally, they have it. So HelloFresh meals are ready in 30 minutes or less, which is so great for me because I have a family of 5 and everybody decides to eat something different every single night.
I think that's the way it's supposed to be.
No,
no,
it's
okay.
not.
Well, maybe not. Well, thank you HelloFresh for allowing for my family to all have different meals. But nevertheless, go to HelloFresh.com/LWL14 and use code LWL14 for up to 14 free meals and 3 free gifts. Wow, that's amazing. Go to HelloFresh.com/LWL14 and use code LWL14 for up to 14 free meals and 3 free gifts. Everybody, it's America's #1 meal kit. And now while we're talking about things being #1, CrowdHealth. One of the things that you just mentioned that I thought was absolutely amazing, you talked about really, simplicity being one of your monikers. Is your company's thing is all about simplicity, but it's about really taking that thought away, giving a peace of mind. When I go to the hospital, we have 3 kids. Mm-hmm. And I remember going to feeling that amount of anxiety, going to the hospital thinking, well, how much we're going to have to pay.
We had 3 C-sections.
3 C-sections. Like, how much we're going to have to pay for this?
Those are like $40,000 each.
and for like what you mentioned, like for my wife and I, while we had anxiety over how much we're going to pay, we were in a financial position where we weren't worried as much. Yeah. But there are millions and millions of Americans right now who are trying to figure out, how am I going to keep my family health together? How am I going to, how am I going to take care of my kids? How am I going to pay the rent? How am I going to do all those things? And I love that CrowdHealth comes to add that simplicity and provide that peace of mind.
Yeah, absolutely. I mean, we are focused on simplicity and community, right? Those are the two just core values of what we're about. And so that really drives everything that we do, is just to make sure it's simple and affordable, and that community aspect of what we do is really, really important as well.
I love that. So just so you guys know, our listeners, we love them so much. We signed up. We left what we were using, the health share immediately. After we did some research, we're like, wait, hold on, this exists, And so we just feel like we love it so much. Our family uses it. And so we want to make sure you guys, if you are struggling with your healthcare provider, if you are finding every time you go to the doctor, something's not covered, it's in network, out of network, you're getting all these bills, you guys, let's cut out all that stuff and make it simple. And that's why we left and we went to CrowdHealth.
And when she says we, she's talking about all of us. It's me, her, and our 3 kids.
Yeah, and
we're
our 3
all
kids.
there.
We're all on there.
And we're sharing with all of our friends because this is pretty important. Y'all know if we're going to bring somebody on the podcast, if we're going to have you guys to talk, if we're going to have them to talk to y'all, y'all know that it's important to us. And we like to share with y'all because y'all are like our family.
Yeah.
And we know that people out there are struggling.
And there's entrepreneurs. There's a lot of business owners.
There are a lot of business owners. Yeah.
And they're always asking what healthcare. And it's just like, you know what? This is just so simple.
It's very simple.
And let's just cut out all the drama and yeah.
So let me ask you this, Andy, for the single moms out there, for the, the 2-parent households, for the single fathers, for those families out there who are just struggling and they're asking themselves that question, so I know some people are going to ask themselves this question. They're going to ask themselves, can I really afford this? Can I really afford to get CrowdHealth? Is this something that I do? Is this something that I really, really need? Because I know a lot of people who don't even have health insurance. What would you say to them right now?
Yeah, and it's make a really good point. A lot of people don't have health insurance. We have 30 million Americans who don't have health insurance. And interestingly, half of the people who signed up for CrowdHealth come to us from being uninsured. Wow. So it was like we're finally giving them an affordable option that allows them to have, some coverage when they have a big healthcare event. And so, we absolutely think this is something that, is affordable. Finally, like I said, it's about 50% versus what you'd pay on healthcare.gov. You don't have any of those big deductibles, so it becomes affordable if you have a big health event. And so, affordability is kind of core of what we do. And, just to give you some more details, if you're between the ages of 6 and 54, it's $175 a month, which is just very reasonable. It's a little bit more if you're younger, a little bit more if you're older. And that, again, $500, you're committed to that first $500. It does also pay for your annual visit. So for the ladies, it's your OBGYN visit. For your kids, it's your pediatric visit. For guys, it's your primary care visit. It also includes unlimited virtual care. So we've got doctors that can cover any state in the United States. You can have a virtual visit with them. If your kid has a cold or strep throat or whatever, they can prescribe they can prescribe medications virtually. So it's unlimited. You're not paying for that. So there's just a lot of benefits to joining us that you don't get with your typical health insurance plan. And like I said, it's at a much lower cost, all because we're treating physicians really, really great. And that's the core fundamental piece of this. The problem with our healthcare system aren't docs. It is the intermediary, the health insurance intermediary there that really is the problem with the health insurance system. And so we just love being like a pro-patient, pro-doc organization, and that the fruits of that are significant.
And well, I was going to say, let me add some reality to this. So for the amount that he just said that it cost, crazy. Y'all have shoes in your closet that you paid more for. Let's just be honest.
Yeah.
Like totally. I haven't gotten a pair of Jordans I haven't gotten a pair of Jordans. Come on, dudes. Your shoes too. I'm saying our closet is more expensive. Yeah, so even when you hear Andy talk about affordability, I want you to understand the necessity behind it. Because I love something that he mentioned. He was talking about those major health moments. Yeah. Those things that you don't know what's going to happen. Yeah. And to be able to have that peace of mind, but not only just a peace of mind, but the simplicity, the protection that goes along with that simplicity. It's just something that cannot be put into words. So I think it's amazing.
And then also, if you guys have a 9-to-5, I worked as a benefits manager every other Friday. Somebody would come up to me and ask me, why is so much money being taken out from my health insurance? And I'm like, you have to actually look at what you signed up for. So go and look it up and then see what it actually covers, right? So if you have a certain issue, it's not covered under your insurance. Guess what? Guess who's paying for it? You are, right? And my issue and my struggle with other past health shares that we used is that we actually had to pay for my C-sections up front. Y'all, we had to pay,
the whole
we had
thing.
to pay the whole amount up front, and then we got reimbursed.
And prayed that the money came in to reimburse.
We got reimbursed down the line, maybe a month or two down the line. So, I mean, we were okay, but I wondered if somebody had a huge surgery, if somebody had, breast cancer, something big happened to them, it would wipe them out financially.
Yeah.
Right. So you guys, we want to encourage you guys, go sign up for CrowdHealth. Can you tell them where they can sign up and all that other good stuff?
Yeah, real quick too, is I was a part of a health share at once too, and we were kind of taking some of the best parts of that and some of the really hard parts of that, and then really correcting some of those pieces that are really hard on families. Like if you had a C-section, that's at $15,000, $20,000, $25,000, like you have to come up with that. And like, let's be honest, not a lot of us have 20 or 25 grand sitting in a bank account for a C-section, and so for us, we actually will pay that directly. It doesn't come out of your pocket. You don't have to get reimbursed for that, and so that's really kind of a key to what we do, as well as making it just super, super easy. We just had a woman who had a brain hemorrhage. It's a couple $100,000 bill, and she was uninsured before. With CrowdHealth, she'll get it paid for. Just a couple months ago, she was uninsured, and that would have destroyed her and her family and would have put them into bankruptcy. So that's really why it's so important to have some kind of help. Go to joincrowdhealth.com. You can use the code LWTL, and you get a month free to try us out. If you don't like us, that won't be the case, but we know you'll love us and you'll want to stay around for a while. And if after 3 months of you being with us, we'll send you a free wearable. We're sending a lot of Apple Watches out nowadays, so we get a free wearable with this. If you use LWTL as your promo code, and the whole point behind that is like, hey, we want you to be healthy. Those Apple Watches are awesome in terms of keeping track of your health status, and so we're going to send you one on us.
That's amazing. Really quick, I want to say this about the virtual part. I love that you guys have virtual doctors that can prescribe things. I remember back when a couple months ago, my son wasn't feeling well, and I'm like, dang, we have to take them to the urgent care. And I know people are really, really sick there. He's not that sick, right? He just had like a pink eye or something. You know what I mean? So I'm just so thankful to have virtual care, so I don't have to go in and kind of surround myself with a lot of people who are actually sick.
Yeah, it is so convenient. And especially post-COVID here too. Or I want to be post-COVID, but during COVID, people are just more willing to go virtual in those conversations with the doctors. And it's something like 80% of the time, the doctor can take care of your issue virtually. You don't have to be, in front of them. So it's super convenient. And we recommend everybody start virtual first. You actually tap something on our app. Within 2 minutes, a doctor will be up and you can see his or her face. Or if you don't want to see his or her face, you can do it on the phone. Either way. But that's just a great way to start, so that you're not going into a situation like the ER or urgent care or wherever, where there are a lot of other kind of sick people hanging out. They can give you at least some guidance there really, really quick.
I love that. Andy. We really appreciate having you on. I want to say this to everybody who's listening right now. You know what? The new year is coming, and people have been asking, people are always like, oh, what are you giving me for Christmas? What are you giving me for Christmas? If you are not insured, let this be a gift to yourself. Yeah. Not only that, but also if you have the means, like, gift this to someone else. Yeah. Let this be a gift that you give to somebody else. And with our promo code, not only do you get, you get a month free, but then you also get the free wearable. I tell y'all what, let's go further than that. Let's look at what you get the month for free, but make a commitment today that you're gonna let this thing last for a year. Yeah. Let it last. I mean, really give it an opportunity for it to bring about the change that it's going to bring about in your life. And here's the great thing that we know. We know that it's great. That's why we're doing it. That's why we have family. That's why we're part of the family. That's why we have Andy with us right now. Yeah. So everybody, we're gonna make a commitment here. We're gonna go for a whole year. Go ahead and sign up right now. Again, we're going to joincrowdhealth.com. And we're using code LWTL. Yeah, we're using code LWTL. That's going to give us a free month, and we're also going to get a free wearable, guys. So make sure that you jump on board and join in the family today. Yeah.
Thank you guys so much for having me. Appreciate it.
Thank you.
Thank you, Andy.
And everybody, speaking of free wearables and all those other kind of great things that we need to have in our life.
Therapy. That's what you need in your life.
But we're not going to say it like that. Say it like, because we all need therapy. If you didn't get an opportunity to listen to our podcast last week, I would greatly encourage you to listen to it. Yeah, it was about childhood trauma that ultimately becomes adult problems, and I thought it was great. But speaking of therapy and speaking of all those things, a reason why I brought that up is because we got a chance to learn about some of our childhood trauma through therapy, and BetterHelp has been our sponsor. BetterHelp has been absolutely amazing.
You guys, it's not a crisis line. It's not self-help. It's professional counseling done securely online. You can connect with a counselor within 48 hours. The cool thing is you go online, you fill out this application within 48 hours, you're able to get matched with somebody, and they will literally help you and walk you through whatever journey you're going through. If you're struggling with anxiety, insomnia, depression, whatever you're facing right now in this season, maybe you're struggling with childhood trauma, comparison, whatever the case is, they will help walk you through it.
Yeah. So make sure that you guys jump on board with our sponsor, BetterHelp. Everything you share is confidential. It's convenient. It's professional. You have to go worried about sitting inside of, some waiting room. Oh my goodness. Everybody's looking at you. You don't have to do that. It's affordable. And the great thing is they also provide financial assistance. So all you have to do is apply for the financial assistance. You can get that. But we want you to start living a happier life today. As our listeners, you'll get 10% off your first month by visiting our sponsor at BetterHelp.com/Lindseys. Join over 1 million people who love taking charge of their mental health. Again, that is BetterHelp, HELP, BetterHelp.com/Lindseys. And that's LINDSEYS.
Now, man, I love Andy over at CrowdHealth, y'all. Like, for real, I love what they're doing. I feel like he figured out a solution through a really hard time. Right? So I figured we could make this podcast about like tips for entrepreneurs, business owners, people just...
We're just coming up with titles as we go along.
I need structure, if you haven't noticed.
We're just talking. We're just talking.
No, we're not going to just talk, babe, because if we go in circles, people came on to spend their time so they could hear direction. We can't just be talking.
We give them direction. We could be talking.
All right. So I want to talk about entrepreneurship.
Okay. Well, number one, join CrowdHealth. Go to joincrowdhealth.com and use promo code LWTL for a free month. And not only that, but you also get a free wearable. But we're making a commitment that we're going to stick with it for a year.
Come on, stick with it.
You get a month for free. So all you got to do is you just investing into 11 months. And y'all got shoes in your closet. Yeah. It's worth more than the monthly amount that you'd be paying, which is cheaper than healthcare.gov, might I add.
I agree.
Ding, ding, ding.
I agree. So I think one of the first questions I had when we first went to entrepreneurship was like, what are we going to do about insurance? Yeah. Right? What insurance is out there? And I honestly, there wasn't insurance like it is now. Like the fact that I wish we had CrowdHealth back in the day. Yeah. That would have definitely saved us a lot of money. Well,
yeah, I mean, because I remember we started researching, some of the major companies out there. And then we were like, well, this is all you cover. Like, but then, depending on the amount we have to spend, if you spent more, then I guess they covered more. But then it's like, well, you're just getting started, and we didn't have the money back then to really afford the cost. And I remember remember the time I went on healthcare.gov, it was when it came out. And I went out, I was like, okay, I'm just going to go out here and just, for poops and giggles, I'm going to just go out here and just see.
Was it the Biden care plan or something?
No, it was Obamacare.
Obamacare, yeah.
I went out there just to go see what it was about. Just go see what it was about. And I put our information in. At that time, it was just me, you, and Logan. Yeah. And I remember putting it in. I rember it was like $3,000 a month. And I remember thinking to myself, like, who gonna pay $3,000 a month? No. I'm like, and then I remember the minimum, not the minimum payment, but the deductible. Then was expensive. I was like, hold up.
Like, who's going to sign up for this?
I was like, yo, make so sense. I got to pay $3,000 and some dollars a month. And at that point, we just figured we just going to use the Holy Spirit because we ain't got no.
Legit.
I'm going to trust the Lord.
We went through a season where we didn't have health insurance because we couldn't find one that fit our needs.
And we couldn't afford it. We couldn't afford the health insurance.
Yeah.
We were trying, we were legit trying to find something that we could be able to have. But that was a big problem. We couldn't find anything that was going to be that was going to be good.
What
for
other
us.
problems did we run into as entrepreneurs besides that?
I mean, the working together type of thing. I mean, especially when you're a husband and wife duo and everything.
So this one used to think just because we're sitting here talking and working that this is actually quality time. This is not quality time. This is work.
This one.
This is work.
This one.
Quality time is where I'm looking into your eyes.
This one. You said you called me this one.
Oh, I'm sorry,
That's
baby.
disrespectful.
I'm sorry, baby. I would never intentionally disrespect you in your life.
Oh well, you did just then.
Well, I
this one,
repent.
you know, that took me back to my Mississippi days.
Really? I've never
Oh yeah,
heard
when
of that.
they call me boy, and this one.
Oh,
Look at that one right there.
no.
This one.
Oh, well,
this one got a name.
my fine husband, Cornelius Antonio Lindsay.
Ooh, you used the whole government name. Wow, you giving up my middle name like that. Oh wow.
My fine husband thought that this was quality time. So that was actually one of our struggles when
It wasn't quality time? This ain't quality time right now? We're having a good time.
we're having a great time. But this ain't no date.
People.
This
We're
ain't
talking to all our cousins. It's like a family reunion. The family reunion.
All right. So we struggled with working together. And one thing that worked for us is figure out our areas of strength, and we just focus on those areas.
Well, let's be honest with the people. We just got to the point where we just had to separate our working together because we were like, this ain't going to work. Because obviously I
can't lead and he lead. We can't lead together.
Yeah. We can't lead together. So it can't be like, oh my goodness, like she's running women's organizations and doing stuff. And I just have to just back up. She wants to do her women's conference the way she wants to do it.
I do.
And when I come in, I'm like, well, you probably shouldn't do it like that.
I'd be like, I don't.
You probably should consider this. And you probably need to and
but
then
some things I did listen to. Baby.
and then I got up from the table. Because I said I can't. I'm not going to keep giving my opinion here, which I was. Opinion is unasked for advice.
So this amazing husband.
About to say this one. Woo.
This amazing husband, Cornelius Antonio.
That other side
Lindsay.
coming out.
Sorry, Cornelius Antonio Lindsay. My darling
government name
since August
Call me
10th,
C money.
2010.
Call me C-Lo.
C sexy.
Call me
Can I call you
Neil.
C-sexy?
No, call me Neil.
Okay. Anyways,
Call me Neelius.
my darling husband would pull up to my women's ministry meetings at the end.
You wanted
Hold
me
on.
there.
But he would show up at the end, y'all.
You wanted me there. I was
Baby,
busy.
Right. I did want you there, but he would miss like all the meetings and he would show up at the end and be like, no, all y'all need to change this. And there's like 12 girls looking at him like, where have you been the past 6 months? Like, what do you mean you're changing everything? We've done all the research. So long story short.
The research was wrong.
Long story short.
The amount of words that she wanted to say in that moment, but she restrained herself.
That's the Lord.
The gospel.
That's the Holy Spirit working in me. Come on, Jesus. Thank you, Lord. Holy Spirit, activate.
Holy Spirit.
Right. So we had to learn, like, for example, with him pastoring, that's not my passion. I don't want to pastor whatsoever. Never have. I'm an evangelist. So when people say, Pastor Heather, I'd be like, no, I'm evangelist. I travel and I preach. That's my area of strength. So when he pastors, I'm here to support him and get behind him, but I'm not leading as a co-pastor with him. Because for us, somebody has to be in the defined leadership role, because if they're not, the lines will get confused. If I'm making decisions, he's making decisions. But actually, we do it with this podcast. We work well together on this podcast, but you lead on it.
No, I don't. You just said, well, the title was good. What we gonna talk about?
No, I mean on the details, the meetings.
I put together. I got to
set this up
because you don't know how.
I do know how. I just let you set. Wait, I didn't set up today. I didn't set up the laptop, the lights.
So when you are stressed out and when anxiety is really hitting you and life,
better listen to
life is getting extremely difficult. It's important to listen to Noom. It is important.
When you want to cut your husband.
Listen, because one thing I'm really glad about, real talk. I'm really glad about that mental health is becoming a global conversation, but
Absolutely.
it's not something that is just global, but it's also something that's being talked about personally. And Noom has been a great provider to be able to provide people with the materials and the needs that ultimately that we need in order to handle our stress, in order to handle our anxiety. So the cool thing is that when we signed up for Noom, one thing that I loved is that there was a questionnaire. We got a chance to fill out the entire questionnaire, which probably took maybe 5 to 6 minutes. It didn't take long. Well, you fill out the questionnaire, and then afterwards they provide you a curated program. And one thing I love about that program is that when I go in there every single day, it's not just saying this is some things that you have to do. It's providing me with the tools necessary so that I can really begin to handle my stress and my anxiety the right way.
That's so good. And you just did in that moment, you passed the test. So did your coach help you through that? Because everybody gets their own coach with Noom, which is amazing. You guys are stronger than your stress. It does not have to control you. You can equip yourself with the tools to help you work through really, really hard times. Worry less, feel happier. Sign up for your trial at Noom.com/LWTL. That's Noom, NOOM.com/LWTL. Sign up for your trial at Noom.com/LWTL. Again, NOOM.com/LWTL.
Yeah, y'all. And I think one thing I want to say too before we go on is that Noom is backed up by science.
Yeah.
So this is not just some app that you're just kind of going on to and just guessing what's going to work. We know that it works.
Yeah.
This is something that I've been using. It is absolutely amazing. I've talked about stress. I've talked about anxiety before many times on this podcast.
We're huge advocates
and
of
we're
it.
big advocates of mental health. I encourage you right now to go to Noom. That's NOOM.com/LWTL. Get signed up today.
But again, we had to define our roles and who was leading in what area. Like, for example, like I have the Busy Trader, thebusytrader.com, traders.com. My husband is not involved. He's there for emotional and moral support.
I don't trade.
He doesn't trade. And then when I get stressed, he's there to help me take the computer, look at, because I had to build a whole website, like the behind the scenes stuff. And that's what I'm here for him too, for like the support part. But the things that he's doing, he's passionate about. Things I'm doing, I'm passionate about. And then we have things that we come together and do, like our podcast. But essentially, we have to get in the groove and figure out what our roles are and then support each other in that way.
Yeah. And supporting each other in that way is something that's important for all of us to do.
Yeah.
It's important for all of us to do. And I think that, one of the things about coming together, guys, that is so important is please make sure y'all got insurance.
Yeah.
Like legit, I don't want to feel like I'm beating a dead horse, but I do want to go back to it. Like, I want to make sure that y'all have the proper insurance that you need, because it's something that Andy said that is so important. And that is what happens in those big moments. And if you have not had a big, health moment, then
medical bill,
then it's coming. I was reading something about financial difficulty and bankruptcy, that more people file bankruptcy in this country due to medical bills.
It's crazy.
Due to medical bills, due to medical expenses. And, you may hear this now. You may be like, oh, I'm going to put it off and get it later. Oh, I'm going to put it off and get it later. And I'm telling y'all, today is the day. Procrastination is pride. Procrastination says that I actually own my time. You don't. No person, no mortal being can own time. You don't own your time. You're on borrowed time. You don't know what tomorrow's going to bring. Tomorrow could bring something that can completely, flip your whole life upside down. God willing, that will never happen, but we don't know. But when we get an opportunity to hear something that can ultimately be life-changing for so many of us, we encourage you to jump on board today. So we want to make sure that you go to joincrowdhealth.com and use promo code LWTL. Yeah. You're going to get a free month. You're already getting a free month.
Just try it out.
And you're getting a free wearable. Andrew's just talking about they're sending Apple Watches. So if you don't do anything else, just get you an Apple Watch, man.
Since you already have an Apple Watch, I'm getting the one that we get.
No, hold on. Everybody calm down.
You have an Apple Watch on your arm now.
I do, but I need a new one. And then I actually use mine. I go to the gym every single day. I use mine.
I don't work out.
You do work out, but you don't work out like me. Like I have to track my calories and like my walks and my steps and stuff. But nevertheless, remember, and what we talked about earlier, y'all, You're going to go in, they're going to give you a free month, but let's just go ahead and stay on it for the whole year. Give it a whole year,
for sure.
let it work, and then come back and let us know. That's all I got to say.
I think what's interesting is whenever I go into people's GoFundMe accounts that people send me, I get lots of them on a regular basis. They'll say, "Oh, it's our medical bills because things are not covered by insurance." And GoFundMe is not health insurance, right? And so that way now you're dependent on people to help you get through this life event that you're going through. And that's why I love the safety and the assurance that I get of signing up. Like, we'll never leave CrowdHealth. Like, we're with them.
Yeah.
You know what I mean? If anything ever happens to us or the kids or anything health-wise, I know we're covered, and it's so nice to have that peace of mind.
And to know that it's simple enough that I know when I go to the doctor, I'm gonna have to just pay $500.
And that's it.
$500. And we can always put together an emergency, fund somewhere. $500. That's gonna be it. But nevertheless, y'all, we always appreciate y'all being with us. We love that Andy was with us. Andy, thank you so much again.
Yes.
Make sure you go to joincrowdhealth.com.
Yeah.
Again, it's joincrowdhealth.com. Use promo code LWTL for 1 free month. And also you will receive a free wearable. And we're going further than that with Life with the Lindseys. For everybody, we want to make sure that y'all stay on for an entire year. You're already getting a free month and a free wearable.
Mm-hmm.
You're just locked in for 11 more months. Cheaper than some of the shoes and clothes you got in your closet. All right?
Yeah.
So
and shout out
y'all.
to our producer, Garrett. We love you, bro.
Yes.
Appreciate you. We know you put up with us a lot.
Thank you.
Thank you.
All right, y'all. We love y'all so much. God bless. That's too beyond.
You do that every time.
Bye.